Thank you for those updates, Dr. Chan. Thank you, Governor, as well. With today being the day that FDA is going to be evaluating the science and the data, I was inspired to pull out the spectacles so that we can be ready. Rhode Islanders can be confident that in addition to my colleague in infectious disease, Dr. Chan, there's an entire team of people across state government and at the local level who have been planning on this for weeks to ensure that we have a safe and effective vaccine available and accessible to all who are at higher risk and who need it. I want to particularly recognize and thank Director Courtney Hawkins, as well as Alicia Mahalikas and Tricia Washburn, all tremendous leaders in helping to ensure that we do this well and effectively, which we know that we will. Very briefly, I want to circle back to something I referenced last week. The Centers for Disease Control and Prevention has posted some new information on quarantining, as I had shared. This updated guidance adjusts the quarantine period for most people. We want to share that that will be rolled out here in Rhode Island. The data is helpful and it's effective to continue to ensure that those who are a close contact quarantine and stop the spread of coronavirus. If you are a close contact, you should now quarantine for 10 days from your last exposure to the person who had COVID-19. Close contact means you've been within 6 feet of someone with COVID-19 for a total of 15 minutes within a 24-hour period. After quarantining for 10 days, you can continue to resume your activities, but should continue to monitor yourself for symptoms very carefully over those next 4 days. That's how we are able to make this adjustment. You can also shorten your quarantine to 7 days if you have a negative result from a test taken 5 days or more after you were exposed. All of this guidance is available for people who do not have symptoms. It's important and an opportunity for us with going forward. The governor shared the different testing options that are being ramped up. We really want to promote them so that you are testing frequently, particularly if you are in a high-risk group or in a location where cases are higher. This will also allow testing to support quarantining. Someone who quarantines for 7 days after getting a test from day 5 or after should also, for the remaining 7 days, continue to monitor themselves for symptoms. If you get symptoms of COVID-19 during any of those time periods, the same message remains. You should stay home to recover and isolate safely there. You should call your healthcare provider and go ahead and get a COVID-19 test as soon as possible. We have many venues for you to be able to do that, and as has been shared, there's increasing ability to get the test on the same day and quickly and get access to your results. Learn more about what to do at health.ri.gov/COVID/what-to-do. There are some exceptions to this updated guidance on shortening the quarantine period. Very few. For example, if you are a resident or staff of a nursing home, you should still quarantine for 14 days. The last thing that I want to say is that we are updating our web pages across state government. We want to continually make this information clear, simple, and available to you. They can be complex, and so we want to keep working with you so that you can understand, take action into your own hands, and be able to effectively protect your household. So over the next few days, people should expect to see a different look and feel that's easier to access on our websites.